Hi, good afternoon, everyone, or good morning, depending on your time zone. I think we're ready to get started. And we're just so glad we could reach so many of you. I know we have folks from across the United States. I don't know if we have anybody international, but welcome to you all as well. My name is Julie Didkowski, and I'm one of Skyland Trail's 5 National Referral Relations representatives. I live in Atlanta, not too far from the Skyland Trail campuses. And before we get started, I would like to tell you a little bit about Skyland Trail. As many of you know, we're a residential program that specializes in treating adults and adolescents who have a primary psychiatric diagnosis. And today I'd like to share in more detail about the teen program, our adolescent program. It treats teens ages 14 to 17 who have a primary mood or anxiety disorder. And we can also treat clients who may have a history of self-harm. Our 12-week residential program is followed by a 4 to 6 weeks day treatment program. It has 2 evidence-based tracks, CBT and DBT. Ecological systems theory is another evidence-based component of the program. And family therapy as well as academics are also major components of the program. Today, I'm very excited to tell you about enhancements to the adolescent program we made just this year, very recently, in 3 key areas. So first, our adolescent team is now intensively trained in DBT through Marshall Linehan's Behavioral Tech Institute. We do follow a model adherent program. Second, we can now work with adolescents who have mild to moderate substance use. These teens who are clinically appropriate for this track are enrolled in a dual diagnosis group that meets twice a week. And finally, we are a trauma-informed program, and our staff has received prolonged exposure training through Emory University School of Medicine. So now that allows us to work with teens who might have a secondary PTSD diagnosis. Our programs are in network with private insurance, most of the big ones, excuse me, in the area. We're also in network with TRICARE East, and as a nonprofit organization, we do offer some need-based financial assistance. Currently, our adolescent program is actually not on a wait. We do require records prior to doing an assessment, and typically it's about a week or sooner from the time of assessment to admission. And finally, we are excited to announce that we have resumed tours. We actually have an adolescent campus tour coming up this Friday from 1 to 2, and we still have room available on that tour. And then we have another one coming up on Friday, April 14th, and that's going to be from 1 to 2 o'clock as well. I just mentioned a Friday. Excuse me. You can find additional information on our website about programs and services, as well as virtual tours, and that's skylandtrail.org. And finally, I'd like to turn it over to Molly Mercer-Dedman, our education coordinator, and she is going to introduce today's speaker. So welcome, and thank you so much for joining us. We really appreciate your time, and I know you're going to learn a lot through the webinar today. Thanks so much.
Thank you, Julie. As Julie said, I'm Molly Mercer-Dedman, and I'm the education director at Skyland. Thank you all for taking the time to join us today to learn more about the important and relevant topic of supporting teen social media use. Some housekeeping before we get started. This will be recorded, and we will include the link to the recording and the slides from today in an email to you later this week. If you have any questions throughout the presentation, please put them in the Q&A box, and we'll get to those at the end. So with that, it's my pleasure to introduce our presenter today, Brandon Baird and Elizabeth No. Brandon is one of the family therapists at our adolescent program at Skyland. Brandon has experience leading individual, family, and group therapy in community-based settings. He received a bachelor's degree in sociology from Morehouse College and a master's degrees in social work and public health from the University of Georgia. Elizabeth No is another family therapist at Skyland. She has experience working with individuals and families in community health and residential treatment programs. Her experience includes leading both individual sessions and group therapy. Elizabeth received a bachelor's degree in psychology and a master's degree in marriage and family therapy from Mercer University. As family therapists, Brandon and Elizabeth have supported many families in their journeys to connect and find new ways to communicate and support one another. So thank you both for being here today. Welcome, Brandon and Elizabeth.
Thank you.
Thank you very much, Molly, for that introduction. I speak for both Elizabeth and I that we are excited to be here presenting this today on this teen social media use. So let's hop right into it. So some of the objectives of today. First, we're going to explore the pros and cons of social media and technology use. At some point, we're going to explore some strategies for supporting teens with mental health management as social media and technology continue to become larger parts of everyday life. We also want to learn effective approaches for setting boundaries around social media and technology usage for teens. And then finally, identify resources to improve your conversations with teens about social media and technology. So what is social media? Why are we talking about this today? So in a nutshell, social media is an internet-based form of communication. This is where people can share videos, pictures, words, meet new people, create friends, exchange content, exchange ideas. There is really no limit to what social media can do. And that is one of the biggest things that we're going to touch on, because each of these different platforms that we have listed here have different components to it. Some have some shared components, but may be accessible in different ways. One of the newest social media aspects is TikTok. TikTok is a video-based platform similar to that of Vine, except these are longer videos and have more comments under it. You're also able to direct message people. And that is what the main form of this is. Now with Instagram, which originally started as a picture platform where people would post pictures of themselves, has developed more into videos as well, and has also have an added element of stories, which was taken from Snapchat, which one of the biggest things between Snapchat and Instagram is that, yes, you can post stories which are visible to everybody. However, with Snapchat, when there is a direct message sent, it goes away, or so we think. And that's one of the biggest things within Snapchat is that those messages do go away, while each of these other messages, they stay there. Now, Discord is a different form of social media, which is more of like a message board where people join different servers, which are typically surrounded by different topics. And within those different topics, there's different conversations. And those conversations can range from anything that can be healthy, as well as a lot of areas that are unhealthy. There, like I said before, are no limit to what can be exchanged through these platforms, even if Discord says that they are monitoring them to a certain extent. Next is Facebook. I think we all know what Facebook is here, as this is probably the most common one that people know because it's one of the oldest ones. Facebook is, of course, the one where you add friends, you could exchange messages, you could have posts of videos, words, pictures, and people can comment and exchange from there. Next is Twitter, where this is primarily started as a word exchange where people would just post statuses of what they were doing. It has developed into more of a communal space of exchanging thoughts, and has become one of the biggest news outlets, whether that is substantiated news or not, but a lot of people get their news from Twitter. And lastly, the social media of live streaming, whether it's through YouTube, Twitch, and many other smaller platforms, but YouTube and Twitch are the biggest ones, where people can watch people live play video games, talk, address different issues, as well as have a live chat, comment under those videos, and other exchanges of messages. So how much is social media being used? So 79% of Americans have a social media profile, which is up from 10% in 2008 and up from 50% in 2011. With the various platforms that have grown, people have been able to find their niche of what they like out of a social media platform and be able to use those as such. Now, many people have multiple forms of social media. However, people typically stick with the one that they are comfortable with. Social media use has also changed over the years. As I kind of stated before with Facebook, that used to be the leading one in 2014 and 2015. And that has decreased as TikTok, Instagram, and Snapchat have really risen to the biggest forms of social media. However, YouTube has, since its beginning, been a vastly used platform. However, the social media use of YouTube has increased more recently than what it was before. Within this slide, it really shows the different levels of use that social media has based on the different platforms and how often it is used. As you can see, some of these platforms are used almost constantly. People are checking it throughout the day on over a third of these on most platforms. As you see, Facebook has decreased, but those more rewarding kind of apps such as Instagram, Snapchat, and TikTok, where a lot of adolescents are using constantly because they're messaging, they're looking at the news update, they're looking at any other update that they may try to find, and they're going to keep getting rewarded. They're going to try to keep looking at the things that they gain from these different platforms. Now, within COVID, that there has been an increase in online and digital activities. I think this is obvious because what else did people have to do when they were staying at home? We also have to look at the unintended consequences of this. As you know, things like watching movies have increased, time spent on their phone has increased, time playing video games, creating content, and listening to podcasts has all increased as people are searching out the kind of content that they want, and they were engaging in these things more when staying at home. The downside of these is that these numbers have not decreased as the world has opened up a little bit more. And now we'll get into a little bit of the negative effects of social media.
So as you can see, sort of the effects, just like Brandon was stating, we're going to be splitting them up into negative and positive effects. So based off of these two charts, we're seeing sort of the mixed feelings about social media from the United States teens. On the left, you see that US teens on the effect of social media, 31% of them said it was mostly positive. 24% said it was mostly negative, and we are going to talk again about what those two sort of mostly negative, mostly positive effects are. And then sort of on the right side, we can see what these main reasons for the negative effects are. Those can include bullying at 27%, harms in relationship and in-person contact, peer pressure, causes in mental health use, and there's a good 12% for other negative effects of social media. And so I kind of wanted to really focus on too, and this graphic specifically on body image. Oftentimes when we think about body image, we think of females' perspective, and I wanted to highlight too, there's a male component here. 87% of women and 65% of men compare their bodies to images they consume on social and traditional media. Something that really stuck out too for us as well is it's twice more, double damaging for teens who know the person and they're seeing that as compared to somebody they don't know, like a celebrity, a stranger, just somebody that's scrolling through. So what we always kind of recommend too, moving forward in our presentation, is ensuring what you're also posting on social media as parents.
And so why do we keep going back to social media use? Well, we get rewarded by this, and this is whether you're a teenager, and this is whether you're an adult. At all ages, we have this dopamine reward loop that goes on to where once you pick up that phone, you get happy. It increases those levels of dopamine. And when you don't use it, those dopamine levels decrease. We can have feelings of more sadness than what it was before. And that constant switch of dopamine levels can make you feel that the social media use is better for you. However, there can be negative consequences associated with that, because if you're not seeking out an increase of dopamine levels in other ways, such as hanging with friends in person, such as playing sports, such as having fitness, such as doing activities that are outside of electronics, you're going to be more focused on that social media dopamine release, and then you're at more risk for the negative consequences that come with that use. So in thinking about some of the common negative effects, what particularly are those? One, it's seeking more feedback. When we seek feedback, it's such things as, I'm going to post this picture on Instagram, and I'm going to try to wait around for how many people will like me. I'm going to wait on how many people want to interact and compliment me. I also want to see, what are the people going to say about me negatively? Is that going to be there? And this has come into such a negative effect that you see that when people do not get the kind of feedback, the likes, the comments, or the negativity that they expected, they'll delete it and they'll try again. Because the dopamine release that they were getting from it and those expectations that they wanted from it weren't up to the standard that they expected. Another thing is a decline in family communication. So often when we're engaged in social media, it takes away from that interaction in family to where we aren't communicating how we feel in situations. We're diving into our phones to deal with what happened throughout the day. And this leads to parents not knowing what's going on with their adolescents. This leads to less time for family quality time together, especially family quality time that doesn't involve electronics. Another aspect of this is the decline in quality and quantity of sleep, because the algorithms of these social media platforms are intentionally trying to make these things addictive, that you're either going to spend more time on this, or, as we all have heard of recently, the blue light that's associated with using our phones that disrupts our circadian rhythm, that affects the way that we go to sleep. And that's why doctors have told us that we need to put away our phones and our electronics at least an hour before bedtime, because it will affect our sleep and it will affect how our mind is able to calm down before we go to bed.
And something I wanted to add in that space too is oftentimes, especially with your teens, they will say, oh, I'm going to turn off my phone. We always recommend not on your bed, needs to be in a different space, because again, that waking up throughout the night, the quickness to pick it up, the blue light hinders a lot of that sleep cycle again. So just, again, we're going to kind of talk about that, but I did want to, in this moment, identify, we don't recommend, it's not suggested to be laid on the bed, potentially a nightstand or in a different area.
And another negative effect is that increased feeling of depression and loneliness. When we see that picture that someone's on that trip to Dubai, how do we feel about that? We didn't get to go to Dubai. Wow, now I'm feeling sad. Now I'm feeling hurt. I want to do that. I'm not able to do that. When we're really not looking at the full perspective and the full picture of what's going on. Who knows if that person is that person's first trip in 5 years? How do we know that or not? How do we know that is that a made up picture, which is known to have done as well? When we don't get the full picture, which social media is great at hiding, that can increase those feelings of depression and loneliness when we begin comparing and feeling that we're left out of these situations. Now, enough about the negative effects. Let's get into some of the positive things that do come from social media, which we want to make sure that we boost. One of the positive effects is that in research, 66% of the adolescents say that they support causes and issues that were important for them. Social media has given social justice a way to interact with those things and other aspects that we want to increase as a society, whether it's environmental, social, or anything else like that, political. 80% of the teams said that social media helped them feel connected to their friends. So often, especially during a pandemic, we weren't able to get that interaction with friends that we were used to. Social media has helped with that. It's also been able to extend our reach of friends that's been across the country, that's been in different places. How do we stay connected with people that we knew for so long ago? How do we stay up to date with what they're doing and how they're doing? Social media has been a great way for that to be a part of that. And lastly, 66% said that they interact with more diverse groups of people. There's more interaction of different thoughts, different perspectives, more diversity of what is not the norm within the society and the bubble that people may be in, and not even recognizing that they may have been in a bubble. There's some other common positive effects that increase communication with long-term relationships. We share and provide information. People may not like all the news on Twitter, but tell me there's another place that's quicker. In so many aspects of news, immediately go to Twitter to report. And it's a great way to get that information out. It's also a great way to connect with like-minded people, whether it's sports, different interest groups, gaming, whatever it may be. You connect with those people and you're able to engage in those kinds of conversations and interactions. There's also been an increase in health-related behavior, people encouraging each other to work out, people encouraging each other on how to get started with working out, to continue working out. There's a lot of great content creators out there that's encouraging healthy interaction within the gym, healthy interaction at home, boosting that self-confidence to get started, because that's one of the hardest things when thinking about how to get started with those health-related behaviors.
And I did want to speak. Oh, go ahead, Brandon.
And lastly, encouraging conversation about those diverse topics, as mentioned before. Go ahead.
I was just going to say, I think the increase in health-related behaviors is also shown, especially through TikTok, right? A lot of the teens will be like, there's positive and negatives. And I also wanted to highlight, there's a lot of body positivity also out there too with health related, finding a lot of mentorship. There's a bunch of apps out there, myself included, using apps that help me, identify my workouts, and I can just follow through. So I think there are a lot of positive effects for social media and kind of everything that Brandon has identified. And so this kind of leads us into resiliency factors. And what are resiliency factors? This is the process and outcome of successfully adapting to difficult situations and life experiences. This, again, in sort of shorter terms, is how we're flexible and how we can adapt to things. And some of these resiliency factors, their ability to cope. This allows us to sort of avoid the negative impacts. This also can be where if we have a sense of belonging, we're probably more able to lean on those people to help us go through those difficult situations. It's in real life support. It allows us to be more self-aware of what we're struggling with, and there are alternate sources of validation. Something that can also, this is another way to help people develop positive resiliency factors on social media. They can cope and manage. It's just a great way for them to face adversity.
So what are some of the factors that really influence depression and anxiety? Well, one of those things is the number of likes. Equating the self-worth, the self-esteem, and how other people view you by looking at the number of likes. Another thing is how others appear, going back to how am I being compared to these other people? How, am I looking at this person feeling that they're better than me and that I'll never be able to get there because of the circumstance I'm in? Another thing is who is commenting. Am I being bullied? Am I getting that negative attention? Am I getting attention from the people that I wanted to? Or am I waiting around for the person that I want to comment? Another thing is what is being said. Are we taking what other people say fully to heart? Or are we taking those things in stride? Are we really understanding the reasons why people are saying these things? Another factor that increases depression and anxiety is having anxiety and depression. If you have a mood disorder beforehand and you're engaging in social media in unhealthy ways, it's an easy way to facilitate those negative feelings if you're not handling them and managing them appropriately. And lastly, poor social supports in real life. If we don't have the people around us in real life that we can see in person, that we can reach out and hug, that we can reach out and go to dinner with, it makes it really tough to when we only seek for these people that are online that we may not truly know, that we may not truly interact with on a fully social level and only in one area. Elizabeth, I think I passed over one of your slides. Did I pass over that one?
No, I don't think so. I think it's good.
Okay. So what are some of the strategies that are helpful for, helping your team have appropriate social media use? Because one thing that Elizabeth and I have always talked about and always agreed on is that taking away social media completely is not healthy.
Mm-hmm.
There are the positive benefits from it. And quite frankly, a lot of social media is the new way that teenagers interact with each other. And if you take that away completely, that can affect their social life in a very unhealthy way. And rather than saying, let's just take it all away, we have to learn what is appropriate and healthy use of social media. And from there, we can more gain the positive consequences of those interactions and be less at risk to those negative consequences. And I love this quote from Jacqueline Sperling. Parents' frequency of electronic use can set the tone for what is permissible to their children. If you want your children to put their phone down at dinner, that will be more likely to happen if you do the same. Which brings me to my first point, that you have to model the behavior that you want your adolescent to have. It is unfair for any parent to say, I want you to not use your phone for more than 2 hours a day if you're on Facebook for 4 hours per day.
Mhm.
If you're constantly picking up your phone and checking the next status on Facebook or checking what your friend commented. You model the behavior that you want your adolescent to behave in. Another thing is limiting the screen time access. When we limit the screen time access, that's an easy way to cut into that cycle of dopamine, where it's that increase and decrease after use. And this isn't just saying you can only have 2 hours of social media a day.
Mhm.
This is also saying, okay, you have 2 hours of social media per day, and this is the things that you can do in that time otherwise. Encourage those social activities. Encourage getting out into the real world. Encourage exploring new things and being in other extracurricular activities that increase that social capacity that's not just messaging people online. Another thing is to set rules. One of the biggest rules that I have when I talk with families and social media use, which is probably one of the most fun conversations that Elizabeth and I have, is that as a parent, you should have the login information for your adolescent. And that if the adolescent wants to be able to use social media, you need to require them to agree with that.
Mhm.
There is nothing within the parental handbook that says that adolescents need social media. So as a parent, it is your duty to make sure that their use is appropriate, while also having the boundaries that you aren't checking every message, that you are giving their privacy. And one good way to compromise within that space is if you want to check their social media, check it together. Do not snoop behind their back. Do not try to lie to them that you're not doing something that you are. Be honest with what you're doing and what your intentions are and follow through with it.
I think something important too with setting rules is, and sort of like modeling the behavior and limiting, is have the conversations with your teen about what's the purpose of this social media. Like, are you just coming on to, like, do you want to download Snapchat because that's the form of communication that everybody's using? Well, what happens if your messages go away? Having those open and honest conversations with your teen also allows a little bit more of that buy-in with them, right? It's not as much resistance because it's collaborative. Because we all know when we're teenagers, it's independence all the way. And so what way can we do to get a little bit of mom and dad want to know why you need Instagram? Just help us understand. That these are our rules. We'll be looking through it, with you. We need access to it. These are our expectations.
Another good rule to have is to make sure that their account is private.
Mhm.
And that as a parent that you are friends with their private account and that they aren't allowed to have other accounts that they may be trying to hide from you.
Mhm.
And there's different apps that are very helpful in identifying those things. Now, when you have the account on private, one, it limits the people that can interact with your child, which is very helpful. It also ensures that there's appropriate use for what can be spread and posted on these various platforms. Because one damaging factor within this world of social media where anybody can get a social media account and anybody can try to figure out different information about you, is that if you post a certain picture, you may increase the risk of having some bad actors interact with you. And so use the aspects that are important for you. Another rule is block people that may be bullying. A hard and fast rule that if someone bullies you, there's no second chance. Block them and move on. Try to decrease that interaction and making sure that they aren't interacting with that bully. Because if they're doing that, they're encouraging what's going on. And after a certain point, if you used all of these other factors to try to prevent that, that's when some higher administrative action needs to happen. Lastly, a good strategy is plan quality time with your family that doesn't include electronics. Get out the house at least once a week. Have family game night. And have those activities within your family that increase the conversation possibility, that increase the downtime with each other to where it's just simple interactions that aren't always pressured about the expectations and rigors of life.
I'd like to also highlight too, again, speaking from the teen perspective in the sense of allow them to plan a family time too. Like, hey, it's your week, on Saturday, it's our family time. What do you want to do? This again gives that sort of, it's family time. Mom and dad are making me go play this stupid board game, right? These are ways of just allowing that buy-in from them and getting it to be more of a fun situation versus a chore. Always involve your teen when possible in decision making in certain with limits.
Okay. So as mentioned before from Elizabeth, yes, discuss the purpose with your teen. Ensure that they're using it for the right reasons. And as a parent, when you follow those previous rules that you're able to have their login information and you're able to see what they're doing by being friends and connected with their accounts, you can ensure that they're using it for the purposes that it's used for. And when it's seen that it's not used for those purposes, that's when a conversation needs to be had of, okay, we may not be able to use this app. Another good thing is to have a common area for electronics. So often teens will isolate within their rooms on social media, on Discord, talking with their friends in those spaces, which isn't very healthy. That's how you get within that loop. That's how you don't meet other expectations. Require your adolescent to be on social media in the living room, in the kitchen, so that everybody knows what's going on, so that the computer is within a line of sight of you as a parent. That way you can know exactly what's going on and decrease that risk that there's poor behaviors going on. Another thing is to know your apps. Elizabeth and I have told y'all about some apps. One, there's always going to be more. There's always going to be new ones. And there's always going to be different updates to these apps as they go along and develop, attempting to grab that attention from your adolescent. Attention is a limited commodity, and that's exactly what these social media apps are attempting to do for everybody. That is what they run on. They run on attention. And knowing those apps can help understand, hey, what is the attention that we need to focus on this app? And is that actually necessary? Lastly, establish a routine. Let them know when are the appropriate times when they're able to be on social media, when they're able to be on their phone, when they're able to be on their computer on social media. That way, it's easier to guide those time limits. It's easier to monitor the usage. and it's easier to promote those healthier behaviors.
And so this kind of leads into the effective communication. How are we going to talk about this? So how do we effectively minimize isolation and social media usage? Just like Brandon was stating, set limits on time and places that social media can be used. So this can be, again, where you model that behavior as parents. We don't use our phones at dinner time. We don't use our phones during family time. We don't, if we're outside or if you're with a friend, what are those expectations? What are those rules? Monitoring internet usage and create a constructive dialogue. So this again is, hey, I'm noticing, I think iPhone has the screen time like monitoring app thing that's attached. You can see as parents, hey, I'm noticing you spent like 7 hours on TikTok. Hey, what's going on here? How do we sort of, what is the purpose of TikTok for you? Is it, I'm also noticing you're kind of in your room a lot lately. Is something happening that we need to talk about? And then while we can encourage social media connection in a modern world, foster opportunities, just like Brandon said, for social outings. How do we have these in real life connections with people, not just phone calls, not FaceTiming, I think maybe Discord has like a video component to it. I can't remember, twitching, things like that. And monitor who your team's talking to and how they're meeting them. Again, just like Brandon stated, Discord is kind of coming up and there's different types of chats that can occur in those moments. Being more aware of like, where did you meet this person? Do you know much information? Also, something I'm going to state too is online safety. Ensure that your teen is not sending out your home address, personal information, eliciting pictures, things like that. Just safety, online safety. What are those expectations? And have you identified them very clearly with your teen, apologies. And not to demonize social media or creating power struggles. So recognize that today's teens have only known technology. So get educated versus putting all of it away. What are these apps? What's the purpose of them? What happens to Snapchat? What do you do on TikTok? What are the algorithms for it? Do I have some of those? Am I posting that as well? And for the power struggles, they can be decreased by vocalizing, again, very clear expectations and reinforce those positive behaviors. Hey, great job. Thank you for putting your phone down at dinner time. Thank you for putting your phone away in the common space. Thank you for great job for logging off of the computer at 10 o'clock today. Great for unwinding and doing some other skills or engaging in our family time. Always wanting to reinforce those positive behaviors will have an increase in those behaviors that you're looking for, and always be consistent. That's something that's really difficult because I also recognize life happens, and consistency is where we can build those habits. That's where your teen and your adolescent will recognize, oh, mom and dad are very firm in holding these boundaries with me. I know these expectations. I know the consequences that will happen.
So there's also a lot of great therapeutic apps that can be found. And personally, I have used Headspace, I have used Calm. Those are great apps that focus on meditation, mindfulness, a big component within dialectical behavioral therapy. Those things that promote relaxation and more understanding. So not only do we need to have, can we have social media apps, but maybe require one of these apps as well to promote that healthy engagement in apps as well, knowing that there's so many kinds of apps and there's so many ways that we can increase our use of phone and electronics in ways that may not have been possible before.
I do want to also add, I've had Finch before, and it's a cute little penguin thing, and you literally take care of it. I'm not sure if this is the demographics, but it kind of reminds me of a Tamagotchi. I don't know, Brandon, if you had one growing up, but they kind of remind me of that. It's a great way to just kind of also feel positive self-care for your pet, right? And something that I wanted to add as a sort of app that I also have used is Better Sleep. This is a great relaxation, lots of white noise, and it helps track sleep as well for those maybe teens, that kind of, again, that's a little bit of a gray area because they're not supposed to be on their bed, but that is something maybe for parents could be a great way to track sleep.
Mhm. Mhm. Absolutely. And this is not a limited list, or this is a limited list of the possible therapeutic apps or mindfulness apps or relaxation apps that are out there.
Mhm.
Find the one that works for you and use it. Use it consistently. Find it. Find a way to put it within your routine. We also wanted to put a list out there of the various resources that can be helpful within different situations, as it is important that, when we talk about how these are related to mental health and mental health disorders and issues, and we want to make sure that y'all know the resources and the possibilities of how to get help if help is needed.
Mhm.
Being aware of that. In crisis situations, call 911 and ask for a crisis intervention trained officer. Making sure that, if those things are needed, that you're also putting you and your family in a safe spot when using these resources. That we want to make sure that these are handled with care and understanding. And as you may use these things, there's ways to call, there's ways to text, there's websites to go on to learn more information on what do I need to do for this situation? What are websites and different places that my adolescent can go to when they need help and maybe a little bit shy about communicating that? We want to make sure that, one, we want to be able to communicate with our parents, but if we can't, we still need to find a way to stay safe.
Right.
And of course, these will all be within the PowerPoint. And I encourage all of y'all to know the crisis lines within your neighborhood and within your state or county or city. These are some of the resources that we have used in more of some information that may go in a little bit more depth than we were able to get into, that talk about teens and their experiences, the role of parents, the social dilemma, a great documentary that focuses on the social media use, as well as just more information on how social media is related to mental health. So lastly, I know there's a lot of questions and we wanted to make sure we leave enough time for that. So I'm eager to hear your questions and answer them in any way that we can possibly.
Yep. Thank you, Brandon and Elizabeth. Lots of really wonderful information. We do have some questions. So one of the first questions is, what are your thoughts on workaholism related to influencers on multiple platforms? So maybe the appearance of somebody that's working all day or actually is kind of constantly updating their profiles on different platforms.
Yeah, I think that's an absolutely great question, because, this content creation and influencing has become more in the public eye. And I think more recently, coming out of the pandemic, when a lot of people started depending on content creation for their income and were able to start going full time on those things. And the best way that I would say any content creator out there or any influencer is to have limits on yourself. So often that these content creators and influencers get so sucked into that dopamine interaction as well, interacting with their chat on Twitch, getting all those comments, getting all those likes, getting the ad revenue. And then after they've done that every single day for 10 hours a day for 6 months, they say, oh, I got to take a break. I can't stream anymore for the foreseeable future, because they didn't establish those healthy boundaries in the beginning. And they ended up getting into a position that they actually weren't able to handle. No matter what job you're in, no matter what situation you're in, you got to have limits on yourself. Otherwise, you're going to get burnt out and you're going to just take a step away. And that could really affect different aspects of your life, especially if you're depending on that content creation and influencing as a way of living.
Something that comes up for me too is I naturally kind of go to celebrities, right? Because they're constantly, that's almost their platform as well. Somebody specifically is Selena Gomez. I'm not sure if everybody knows, but she has taken breaks from social media. A lot of influencers take breaks. And something I encourage too is always have a support system for those moments of self-care. Maybe having them do check-ins with you too, or, you know, the workaholic sort of check-ins of like, hey, when was the last time you really kind of just took a, what's it called? A cleanse, like an electronic cleanse, you know, when was the last time you really went and just went to the store? Last time you just took a walk? So it's also important to find that social support to just kind of break free from those as well.
Great, thank you both. Another question is, do y'all have any information or insight into the sense of connection or isolation for neurodivergent people and how they interact with social media compared to their neurotypical peers?
Yeah, that's an absolutely great question. There's been a lot of good and bad that social media has kind of released when interacting with neurodivergent people. One is that there's been a lot of support for neurodivergent people where they've been able to see other people who are neurodivergent and been able to connect with them. And the best way that I would say is find the right communities within these spaces and block anybody who isn't understanding and familiar. It's not your job to teach them. It's not your job to promote your self-worth and your autonomy within those spaces. So, if you're someone that is neurodivergent or has a child that's neurodivergent, monitor the communities that they're in and making sure that they're having those appropriate connections. And also making sure that you curate the interactions that you have on social media that best fits you, that's not adding more difficulties to your life, which is much easier said than done. Because once again, the algorithms on social media promote negativity more than positivity, as well as try to get engagement in any way possible.
Great, thank you. We had a couple questions about boundaries, which I know y'all talked about boundaries, but maybe go into a little bit more detail. Someone said that they love the scripts that y'all provided for talking to teens who kind of have very extreme social media habits. So what if the first level of that is kind of not working? How do you create a stronger set of boundaries for families?
Brandon, do you mind going back to that slide just so that we can reference it for me, please?
Okay.
Thank you. Because I remember it was like a lot of, yeah, thanks. So for my initial thought is to set something stronger and sort of, and please always correct me if I'm not interpreting this question correctly. I always, again, want to state, include your teen when discussing this. Hey, I'm dad and I, whoever it is, we're wanting to have this discussion that we're noticing you're spending a lot of time on TikTok scrolling, right? having those, that, and then kind of at the end of this, having that constructive dialogue between them, and they're like, oh, I'm doing fine. Okay, with the choices you've made to stay on this for so long, your dad and I have to, your mom and I, aunt and uncle, whoever it is, have to start monitoring a little bit more to ensure that you're not isolating, to work towards sort of build, this is going to be a really loaded word, but build up the trust for you being able to be on that social media platform longer. I know trust is a big thing for teens too, so I was like, that's a loaded word. And also too, I think for when I think of stronger, I'm always just, it's very firm. There's no wiggle room. So in the sense of, if I tell you your electronic usage has to be off by 10 o'clock is when it has to be off. There's no ifs, ands, or buts. I'm not giving you 10 minutes, you know, I'm not giving you 15. And that's when you discuss the consequence, which has already been identified. A big part that Brandon and I discussed too with our families is identifying those consequences, not in the moment, but already with the teen present. Because again, that buy-in, oh, this wasn't discussed, this is not fair. So having that conversation with them and identifying these are expectations, these are the consequences, there's no ifs and buts. Mom and dad and parents will enforce that when that time comes.
Yeah. Another thing to go along with those boundaries, especially after those boundaries have been broken, you know, you got to start new. Start small when you start new. Hey, you know, based on your previous behaviors online, we want to make sure that we build up the healthy use, and you want to start small. So we're only going to stick with one app. Which app do you want that to be? And then from there, we're going to build that trust, while also having non-negotiables within these things, to where don't be scared to take it all away. You know, things like having sexually explicit media, things like harassment, anything within those non-negotiables, seeking out substances via social media, which is something that's really been big recently. Those are non-negotiables, and don't be scared to take it away. There is nothing, once again, that parent contract and that parent handbook, nothing says that your adolescent needs to have a phone with data.
Right.
Give them the flip phone. Take away the data. The use of the phone is for what? To contact parents for safety. It's not to be on social media. It's not to do any of that other stuff. Be firm on what can happen if these non-negotiables are broken, and have an understanding that if you have to go back to 2004, go back to 2004.
Right. We've gotten a couple questions about age, and if you have any age recommendations for allowing teens to be on social media, is there an age where it's appropriate or not? Kind of how would you help support that decision?
Yeah, that's a great question.
That's a great question.
I don't know if there is a particular age. There has been studies that's shown that the younger someone is, the easier it is for them to be disconnected from social media once it starts. But the biggest thing that I would say, and I don't think many people really recognize this, know the terms of service. Use that as a way to set your boundary. You know, I know on Twitch, you have to be 13 to have a profile. Follow those rules. Making sure that all of your children know the terms of service, and you know the terms of service, to make sure that you aren't breaking them, and use those to your advantage. I'm not sure there's a particular age. I would say that early adolescence probably the best. That's when that social connections have already been established from elementary school and early middle school, and that way you're able to kind of carry on and build up those healthy skills.
I'd also like to state too, again, know the apps. Specifically, what comes to mind is Snapchat, right? Very quick to erase the messages, right? Unless somebody actually keeps it there. So knowing the purpose of the app is extremely important too, on what age your kid may use it. Just like kind of what Brandon's saying, Twitch, know the service. Twitch is 13. I don't actually remember Snapchats, but just given how positively and negatively Snapchat has been been associated with certain pictures, maybe that one needs to be a little bit higher because you're not able to track some of those things. So just understanding what the apps are as well can also help determine maybe not this, you're too young for that. Facebook is probably fine because according to teens, it's super outdated. So if you want to start there.
Thanks. And we have time, I think, for one more question. So someone asked, one thing that they've heard about is teens being encouraged to share intimate photos via social media, and then receiving threats that somebody might repost that unless they get money. So obviously, we don't want our, teens to be doing this, but do you have any other advice for parents to prevent these types of really stressful social media interactions that could be kind of crime? They could be crimes.
Mm-hmm.
So one, there's apps out there that recognize when certain questions like that are asked, and you will be notified. Life 360, the Bark app, those do a great job of notifying when certain messages or pictures or videos are sent to other people. Once again, encouraging accounts be private so that they aren't tempted to interact with people that may be bad actors. Now, in the case that something is sent, I would encourage you not to pay anybody. At that point, you're setting yourself up for failure of losing money, because if you give them the money, what's to say that they won't post it anyway?
Mm-hmm.
So you have to make sure that in those cases, you may have to get the police involved. And in that case, it's a very tough thing, especially when we're talking about adolescents sending pictures. That's technically child porn. And we just have to be careful of those things. And the best way to do that is be proactive, while also understanding if those circumstances do happen, ensuring that you aren't engaging in that will make a situation worse, like giving away money, and address the appropriate authorities if you're being threatened.
I think it's also important to highlight, Brandon and I have discussed this early in our presentation, having login information. So oftentimes, if your teen especially knows that, oh, mom and dad, my parents have this information, yes, they can delete, and it's random, right? But you're also not doing it sneakily, you're doing it with them. So those are moments where they may not know what's happening. And so that also encourages, like, hey, if something's happening, please come and talk with us. Remember that we are here to keep you safe. We want to ensure online safety, and we still have your login information if we suspect something. Always, of course, involve authority, police, higher authorities if pictures do get sent. But I also encourage you, as a parent, you have that right too, to also reinforce and say, we have your login information. We're friends with you on blah, 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 blah. Let's do a check. You seem distant. You seem something's happening. Let's look through your messages together.
Thank you both so much. I really appreciate y'all sharing your expertise today. We have a lot of really good engagement with this, and I feel like this is a topic that we could go on and on about. So thank you so much for your time, and I'll pass it over to Julie.
Thank you.
Thank you, Elizabeth and Brandon. And I did see one question about asking if Skyland Trail offers a non-resident program for young adults who are addicted to their phones. We do not treat process addictions, so we don't have any services like that at this time. So I just wanted to thank everyone again for joining us, and reminding you all, we do have adolescent tours coming up this Friday from 1 to 2 o'clock, and also on Friday, April 14th from 1 to 2 o'clock. You can also reach out directly to me or to any of us if any of those times do not work for you, and we could set up a separate time. Thanks again for your time. I'm sure you all learned a lot, and thank you again, Brandon and Elizabeth. Have a
Thank
great
you.
rest of the week.
Bye.
See you later.